A meeting of the Pontifical Academy for Life is taking place at the Vatican yesterday morning. Pope Francis addressed a group of participants expressing pain at strong inequalities in healthcare and living conditions of people. Joining us now from Rome is Dr. David Barb, president of the World Medical Association. Dr. Barb, thank you so much for your time today. Can you tell us a little bit more about this assembly and what you focused on?
This has been a wonderful workshop sponsored by the Pontifical Academy for Life, talking about the many facets and the multiple impacts of COVID-19 pandemic over the last two years.
And what would you say personally if you were talking to somebody who was maybe vaccine hesitant for some reason, had some concerns about it? What would you tell them?
So I'm from rural southern Missouri, and our vaccination rates are very low because the vaccine hesitancy in my area of the country is very high. And I try to tell them how we were able to develop this vaccine in such a short period of time and why the technology that is being used is safe, even though it is new. And I try to tell them that we have looked at the side effects and the complications of the vaccine very carefully. We've given well over 300 million doses in the United States alone. And the verified complications from all of those vaccinations is very, very low, not much more than other vaccinations that we give, like the flu shot or pneumonia vaccination or mumps and measles vaccination.
And switching subjects just slightly here, I understand yesterday you met with Pope Francis. Can you talk to us about what that was like, what he said to you, and personally what it was like for you to meet the Holy Father?
So that was very impressive that the Pope would give this workshop the amount of time that he did. I think that says how important this topic is to him personally, how important it is to the Church, and how great an impact the Church can have, and those that have been involved in this workshop and the Pontifical Academy, how impactful they can be. The message, of course, was in Italian, and we are expected to get a translation of that soon. But I was able to sit in the very front row, 25 feet from the Pope, during his message. And afterwards, even more impressive, he met with each individual. He had a receiving line and shook hands with all 100 members of the meeting that were in that chamber, this Clementine chamber last night or yesterday. So the fact that he gave us that much time and that much personal attention speaks to how important he sees this topic.
And what an incredible experience for you, I'm sure. Before I let you go, Dr. Barb, is there anything else that you would like to share with our audience as it pertains to the pandemic and COVID-19?
So two things. One about the workshop. This workshop covered, I would say, three large areas. One was the medicine. How do we take care of things right now, and what do we need to plan for in the future? Another part was what I will call the delivery systems. How do we get vaccines to those countries in Africa, for instance, where the vaccination rates are less than 3%? We had wonderful remarks from the director of the CDC of African nations, who spoke just before I did, talking about his vision and how we can improve the structure and delivery of vaccines in Africa. And the third very important part of this conference was around the ethics. Why are we promoting the vaccination? And it is not just to protect each of us as individuals, but it is because we care about one another. And I get the vaccine not just to protect me, but to help protect others.
Well, Doctor, thank you so much for your time today and for speaking with us. We appreciate it. Dr. David Barb, president of the World Medical Association. Thank you again.